Hi, everybody. Today we're going to be discussing diseases, part 2. The important thing to know about this section of our talk on diseases is that we need to be able to figure out what disease is affecting us or our family or friend. So the first step in that is detecting the disease. The second step is avoiding the disease if possible. And the third step is preventing the disease if possible. So first we want to define what a symptom is. A symptom is an indication of an illness that usually reflects a change in your normal body function. It's a warning sign that our bodies give us to tell us that we have something wrong going on. So you might say to yourself, well, that's easy. I can tell when I don't feel well. Usually you can. Sometimes you can't. Some symptoms are easily recognizable, such as chickenpox, because of the spots that they create all over your body. Others may be a little more confusing. A fever, for example, could be an indication of the flu, or pneumonia, or blood poisoning, or a blood infection, or strep throat. Noticing the symptom of a fever often prompts a person to seek medical care, and then that can serve as a way for a physician to diagnose the health condition. It's important that you go see a doctor or a healthcare provider when you notice symptoms with your health. Sometimes those symptoms can be similar in diseases that are in totally different categories. For instance, shortness of breath is a symptom of tuberculosis, which is a severely communicable disease. But it's also a symptom of emphysema, which is a chronic degenerative disease. Some diseases are asymptomatic, meaning they don't have any noticeable symptoms, but the disease is still active in a person's body. With these diseases, it's important to be aware of the risks and to be tested by a healthcare provider, particularly if you know you've come in contact with another person who has that illness. That person may not be asymptomatic or may no longer be asymptomatic, so you may want to be tested for the disease to make sure that you didn't contract it. Knowing how many communicable diseases are spread, knowing how these diseases are spread, is helpful information for being able to prevent their transmission. An example would be staying away from a person who has the flu, because we know that flu germs can become airborne by sneezing, coughing, and even talking. A person with the flu should practice preventative measures, such as social distancing or staying away from people at school or work or even in their own family in their house, coughing into a tissue or sneezing into their elbow, wearing a mask. They should also frequently hand wash. The germs are even more likely to be passed through touching, so we want to be careful of that. Of all the preventative behaviors out there, hand washing is one of the most important. We should wash our hands after using the restroom, before eating a meal, and before preparing or handling food that we will eat or others will eat. When outside, you should be careful to take awareness of your body. Take a look at your skin to make sure that ticks or other insects haven't bitten you, and if they have, those bites haven't become infected. You can check your body and clothes before coming indoors or after coming indoors to make sure they don't have insects on them. The strategies for reducing the chances of foodborne illness are hand washing, keeping cooked and uncooked foods separate. So if you chop up meat on a cutting board, don't use the same cutting board to chop up vegetables that might not be cooked. Keep preparation surfaces clean and keep cold foods cold and hot foods hot. Other preventative measures for communicable diseases include getting shots, drinking only clean water, treating cuts and open wounds correctly, and getting adequate rest and food to maintain a healthy immune system. These are all the ways that we can do our best to prevent, avoid, and to detect diseases that have come into our realm. Thanks for listening.